Okay, I'm going to try and finish on time if everybody meanders to the front faster. There it is, good.
I don't know, but it wouldn't work in PowerPoint today. We'll see what happens.
Can you just say play it? Just do slideshow? No? From start, from current slide?
Okay, I hope it works.
Okay. All right, so we have 3 teams, correct?
3 teams.
We don't have any buzzers. This is really not high tech at all. So Dr. Bosler has agreed to.
So in order to answer the question, you have to raise your hand. So the question, what?
So we're going to go with round 1. And these are the categories. We have Medicare, Medicaid, the finances, healthcare spending, and CareLink. Okay, so these are all talks that we just heard today. Don't look so bored over here in the front.
Okay, younger ones start first.
And this isn't very high tech, so I'm just going to let you know what categories we have left. Nice. Okay, go. Wait a minute. How do I?
You should be able to just click on it.
Okay. These are 5 examples of non-covered benefits through CareLink. You got to get all 5.
The middle group. The middle group.
Sex change,
Yeah.
erectile dysfunction.
Vasectomies, okay. Sex change, vasectomies, cosmetic surgeries. Give me 2 more.
Erectile dysfunction. ED treatment.
No,
that's incorrect. Some durable.
You're right. ED treatment. We got 4. Now give me 1
Some
more.
durable medical equipment.
Vacuum erectile
Good.
device.
Excellent.
Clothing.
Excellent.
Clothing.
We'll get into it now. Yep, you're exactly. So DME, custodial care, acupuncture, vasectomies, sniff stays, although he's sort of backpedaled on that a little bit. Great, you're keeping score?
Yep.
Okay.
Sex change.
$500 so far.
All right, so now we're back. How come I'm having trouble? All right, you guys decide. What's your next?
Okay, you guys get to choose.
Choose again.
Eddie?
CareLink for 400.
Nice. You're feeling good about that talk.
Oh, yeah.
Good. You guys are
Carolyn for
Okay,
400.
the year in which CareLink was established. Oh,
Over
I see
there.
a line of hand over there. Nice, good job.
Chief Resident. You've got to raise
When
your
is
hand.
1997? Good job. Okay, next one. You're up.
CareLink for 300.
My gosh, these are the CareLink experts here. Okay. These are the 3 most common clinical disorders for CareLink enrollees.
Obesity.
Whoop.
He's good.
Over there.
All right, bring it on over there.
Essential hypertension, diabetes, hypothyroidism.
Good job, good job. The other 2 were some dyslipidemia and depression, which he alluded to. Okay, give me another category.
You guys pick a category.
No, they got it right.
Chief Residents pick a category.
We'll take CareLink for
Good.
Carolyn for 200.
One of the 2 criteria required to be a CareLink member. What's happening over here on the right? This is very sad.
They're old.
Oh, these guys are not playing. All right, the Chiefs for 200.
Bear County residents.
What?
Say again?
Bear County residents.
That's 1, but, oh, I said you're right. You have 1 of 2, exactly. Sorry. And the other one was 200% below the poverty level. Good job. Okay, we're going to go CareLink for 100.
We're gonna sweep CareLink.
You're going to sweep it? Well, these guys have already swept a couple, so yeah.
They got 1.
No, well, this one's a give me. This is 100.
What is CareLink?
Nice.
Eddie, you got it.
That was a give me. That was a give me. You guys should have got that. All right, so we need another category from the middle group.
All right, everyone go.
We finished CareLink.
Medicaid for 500.
Medicaid, you guys are feeling.
Medicaid.
3 examples of skills services which can be provided in the home.
Skill services should be physical therapy, cath
surgery, and wound care.
I'm going to say catheter and wound care are all under the skilled nursing care, so give me another. We got physical, skilled nursing, and then what's another?
Pain management. You can't just answer.
Wait, I'm sorry, what did you say?
Turn.
They missed it already. So
Go ahead, you give me the third.
But that, you said
But a skilled service is like a skilled nurse. You know, like I just meant.
Infusion care. That is a poor question.
I think I could. I'm gonna give
I should have said what examples of three
What was your
skilled
other end? What was the
domains. I'm
third
sorry,
end?
different domains. So we've got skilled nursing. All that pain management is great for skilled nursing, as well as TPN.
Occupational therapy.
Perfect. Fabulous. So you have to have either PT, OT, skilled nursing, or speech therapy.
You're killing us.
All right, next.
What's the next one?
Wow, you guys are whining.
All right, Chiefs, up to you.
I'll take who wants to run on the weekends for $500. Medicare for $400.
Medicare. We're switching
Medicare.
topics. You feel okay about that? Okay. Here we go. Who was the first Medicare enrollee?
Ready? What is Harry Truman?
Who was Harry Truman? Exactly. We're going to give it to you. All right, next one. We got a couple Medicare, Medicaid,
Eddie, you're up.
Healthcare spending for 500.
healthcare spending for
I have to
$500.
confer with my colleagues.
You conferred. Okay, good. This is the voluntary drug benefit
What is
program.
Part D?
Wait,
These guys are not even
I
playing.
think these guys got you before you did.
Part D, you
Part D
got it.
Medicare.
You got it.
Is that 500?
You got that was 500.
All right.
That was an easy. That was like give me 500. Go ahead. You choose another category.
Healthcare spending for
Healthcare spending for 400. Okay. The amount per person per year that we spent on healthcare in 2010. What?
We still make
Okay, go for it.
What is $8,046?
Nice. Good job. Okay, I'm going to give it to you. Excellent. Fabulous. You're even better than me. All right. We got healthcare spending 1, 2, and 300. We got the 500 in the Medicare. All right, healthcare for 300.
Raise your hand. Don't just say,
I think you have to turn, Joe. I think you got to turn a little bit. These guys are getting a little short shrift from you on your side.
Raise your hand, don't just.
Okay, the majority payer for hearing aids, eyeglasses, and dentures for patients over 65.
Yeah, the old people should know this one.
Where are the? I don't see any old people.
Emmy raised his hand.
So pay attention.
All right, anybody?
Emmy?
What is personal responsibility?
Got it. So you're right. Who's the patient? That's exactly right. But I will say that Medicare C, the little part that he alluded to, those advantage plans can often pay for some of those services. So good job. All right. So we have healthcare spending for 1 and 200. I know you like the 500s. Those are available in Medicare and finances. Finances for 500, okay. Physical and occupational therapies at home are provided under this funding source.
Emmy?
What is Medicare part?
Yeah, you're so close.
RB.
You said what, B?
Said Bravo.
You're right, bravo it is. Okay, good job.
You started with that. It's a teamwork.
All right.
You just looked around. What is Medicare?
Who's next? Okay, you choose. The only 500 is the straight Medicare aisle.
Let's do
Medicare
All right,
500.
Medicare for 500. Good. Okay. The year and president who signed Medicare into law.
First, middle group.
65 LBJ.
Good job, good job. Excellent. All right, you're up again. What's your category? We got a couple in Medicare, Medicaid, except for Carolyn.
Okay.
And the finances.
Medicare.
Medicare for 300?
300, that sounds good.
All right, let's do it. Premiums for this type of Medicare are usually deducted from your Social Security checks.
Chief Resident.
What is Medicare Part A? She said raise your hand.
You're wrong.
Oh, wrong.
Yeah.
Okay, anybody else? Emmy?
Medicare Part B.
You said B is in Bravo again? Yeah. Don't forget, so Medicare Part A is the entitlement, and Medicare Part B, you just get deducted from your Social Security check on a voluntary basis. So some people can say no to Part B, which is probably not a smart move at this time. Good job. All right, you pick your category.
Medicare.
We 200?
Sure.
And 100 are left, 200, okay. Number of new Medicare enrollees per day beginning in January 2011.
Group C.
1,000 per day.
How many? Good job, 10,000. All right, you're up. You want to finish up Medicare for 100? Okay. Percentage of physicians who are not accepting new Medicare patients in 2012.
Group C.
17.9%.
Yes. Okay, 15 to 20. I was going to even give you the range. Good job. All right, you're up. We have Medicaid, finances, and healthcare spending left.
Finances.
Finances. Okay, you want 4, 3, 2, or 1? 4.
400.
Okay.
Finance.
The amount per person per year that we spent on healthcare in did I already give you that one?
8,000.
Sorry. Yeah,
We did that one.
sorry, we did that one already. My bad.
300.
300. Okay. This is the primary source of funding for Medicare Part A. Raise your hand. I've heard people saying it.
Somebody raise their hand.
Okay, good. So what are the payroll taxes? You have to work 40 quarters in order to get that, and spouses of people who work 40 quarters as well. All right, we have 200 and 100, healthcare spending, Medicaid. Medicaid 200, okay. Source of funding for Medicaid.
State and federal.
State and federal, you remember the percentages in Texas?
60% state, 40%
Nice. Yeah, that's for 200. Good job. You're up again. You were in this stuff.
You're gaining on the two presidents.
You're single-handedly holding up that team.
Going, Corey.
silent partners.
All right, there's another one.
We have Medicaid, 100, 300, 400, finances, spending.
Medicaid 400.
Okay, 400.
Oh, nothing happened there. Oh, what do you want to, what's their
All
score?
right, you have a total of 1,000 so far.
We need it.
You're gonna go for the whole thing?
How are you feeling about Medicaid? Okay, but you're
Why
going.
is everyone asking me?
The whole thing?
Yeah.
These are the number of individuals currently serviced on Medicaid in Texas. If you're close by about 200,000, we'll do it. No, she was close to the millions.
It's gotta be an actual number, I think. It's not-
Perfect, good job. About 3.9 million on Medicaid. All right, next one. We have some Medicaid, finances, and healthcare spending. Healthcare spending, we have 200. Preventive well woman and well man exams for patients over 65 are covered by which funding source? Yep, that's right. They used to not cover it, but now Medicare has that welcome to Medicare.
prostate cancer screening, because it's not a recommendation A or B by the USDA.
That's exactly right. You're exactly right. Thank you for clarifying that. Okay, here we go. Healthcare finances. We have the finances, we have Medicaid, and healthcare spending.
Okay,
Healthcare spending.
Okay, let's finish up that category. Okay, in 2010, the national health expenditures were 2.6 trillion, which is what percent of the GDP?
17%.
Good job. 17.9. We're going to give it to you. I'm feeling generous today. Okay, so we only have healthcare the finances and a couple on Medicaid left.
Pick one.
Oh, what was it now?
If we have
Finances.
finances,
and
okay.
Medicaid.
Oh, we already did that. Sorry about that. Sorry. Sorry, you're right. Okay. 200. The funding source of the hospice benefit. We just heard about that. Go ahead. Good job. Medicare Part A. It's one of the great things Medicare Part A covers. All right, we have finances for 100, Medicaid 100, and 300.
Medicaid for 300.
All right. This is the percent of income that will qualify you for Medicaid.
The percent of
The percent of the federal poverty
the poverty
guidelines.
level income. Emmy. She said less.
No.
Your what percent of income? I mean, that was that slide that showed that if you're a single person, you can get that you're $11,000 or 5,000. I'm not sure what you meant.
It was the percentage of the federal poverty guidelines. Remember how it was like 200 for Carolyn, 400, some for 400. But...
Good job.
All right, so we got one more, I think. Medicaid for 100. You want to take that one? And then we'll move on to the double jeopardy. Percentage of physicians who do not see Medicaid patients.
Emmy.
614?
No. Any other thoughts?
And?
25.
Yes.
17%?
17.
No, I heard it right here.
15?
25%. Yep, 25%. All right, good job. So what are our scores now while we go on to round 2?
Oh my goodness. We have 1,900 for group 3 over here. We have.
All right, well, you figure that out. We're going to keep going. So we have more Medicare.
3,400 for the middle. 34 for the middle. And
Okay.
the chief residents are at 7.
So you see the new categories. More Medicare, since you guys are great on that one. Healthcare reform, third-party insurers, hospice, and then just kind of a
Chief residents
hodgepodge.
are 1,600.
So these guys are winning in the middle here.
You're
You're at 6, chief residents are at 1,600.
Too
All right, we'll
bad.
take hospice for 1,000.
Okay, wow. These are the 4 levels of hospice care. You need to name all 4. Wait, respite? You can get help from your friends.
Inpatient.
Inpatient,
Home.
routine home care, and there's one more.
Skilled nursing.
No, don't say that.
No.
All right, so does it, you guys,
Continuous.
continuous home care, good job. She had the benefit of your expertise for the top 3. All right.
Kids split that points.
All right, you're up.
Jeopardy work.
Hospice for 800. You guys are feeling, since we just had that talk, this should be fresh. 2 indications for continuous home hospice care. One would you? 2 indications. This is for the continuous, the 24-hour.
Nausea, vomiting, weight loss.
Pain, imminent death, acute respiratory, exactly, bleeding. Great, good job, guys. All right, keep going. You want to keep on the hospice track?
Yeah.
Okay.
All right. You guys currently have 3,700.
You guys are feeling real confident about this. Look at all those nods in the back. Okay, here we go. These 3 services are not covered by the Medicare hospice benefit when someone is receiving hospice care. So name 3 things that are not covered.
Treatment or
So radiation, 1.
We're going to call radiation chemotherapy 1. You guys all thinking about the question over here? Okay.
And the little white dots are gone.
Related to terminal diagnosis.
Time's up.
Like
Uh-huh.
accidents.
Uh-huh.
So treatment unrelated to the terminal diagnosis. One last one.
Elective care. Elective.
Cosmetic surgery.
You guys have lost it all. All right, anyone over here want to make a call? Anybody over here? Go for it. No, they said treatment intended to cure. They said treatment. Okay, let's just move on from that.
So who won?
Basically, non-terminal disease, like you had said, like the non-curative. Room and board, like if you want to go to a long-term care facility and get hospice, the patient has to pay for their room and board, but they get the hospice care. ER care, ambulance transport, those. Okay. So you guys are now at 0. You got a lot of work to do to catch up. All right, but you're up again for the choice. You want to move on from hospice, or are you still feeling good about hospice?
More Medicare for 1,000.
More Medicare for 1,000, okay. This part of Medicare covers Advantage and HMO plans.
B.
No.
Those guys are,
C, you're right.
those guys
Minus
are.
1,000 right there.
All right, you're up.
More Medicare for 800.
More Medicare for 800. These are 3 things the Medicare Part B covers. Anyone? Anyone?
Dental.
Chief residents. Medicare Part B.
Wait, is dental one of your answers?
Yes.
Wrong.
Mine is 800.
This group.
All
I'm
right.
like Walt Disney. I'm not afraid to innovate.
No, good. You are the Matterhorn. Good.
Okay.
Physician office visits?
Outpatient facility procedures. yeah.
Okay.
And
What else? Any of these, you guys should be helping under
Medicare Part B.
All right. You guys have it? You guys have it? You guys have it?
Emergency services.
A what?
Emergency services.
I mean, technically that's true because that's an A coverage. So basically, you know,
Oh, yeah.
surgeries, doctor's visits, DME, preventive services, X-rays, clinical research.
Well, don't dentists fall under doctor services?
Dentists are not covered by Medicare.
You're not really. You're not dying.
Dentists pay. Patients pay out of pocket. Similarly, how they pay for their eyeglasses and their hearing aids, they pay for their dental care. All right, who's next? Why don't you guys in the middle choose the category? Since nobody got that.
Healthcare reform.
On a mixed bag.
Healthcare reform for 1,000. Okay. 2 states where it's mandatory for employers to
Chief
cover.
residents.
Say again.
Hawaii, Massachusetts.
Good job. Good job.
Their hand went up first.
All right. What would you guys like?
What was that?
Healthcare
How much was that
1,000. Healthcare reform for 800.
How much was that last one?
1,000 overturned.
Name 2 models of care or reimbursement in the Affordable Care Act that aim to contain cost. This is what the
Eddie,
lawyers spoke
one
about.
is the patient-centered medical home.
Yeah.
And the health insurance exchange model, or that's not.
Talk to her. Go ahead.
Death penalty.
Value cost.
No, you said it. Okay, you're exactly right. Good job. So that's 800 for this team. Did someone say the death? So patient-centered medical homes, the ACOs, pay for performance, and the bundled payments. All right, you guys are up. What category?
Healthcare reform for 6,000.
Okay, healthcare reform for 600.
Pay attention.
These are 3 components of the Affordable Care Act that are currently,
Emmy.
Children covered past 26.
Yeah.
They can't deny you if you have previous health problems.
Good.
And you can't be kicked off the insurance plan. Yep.
that sounds good. Good job, good job. Okay. choose.
A mixed bag for 1,000.
This state has the least percentage
Oh,
of Medicare
Eddie.
recipients.
Eddie,
What is the last?
Nice.
Crushed it.
All right, you're up for what's your next pick?
Mixed bag for 800.
Okay. In order for home health agencies to get paid for services, a physician has to fill out one of these.
Over here.
What'd you say?
Face-to-face.
Face-to-face encounters. That's exactly right. All right, you're up. Give me the category. I'll tell you what number we have.
Hospice.
Hospice for 4 or 2? 4. All right.
big time.
This is big time. Established in 1982 by the Tax Equity and Fiscal Responsibility Act.
Oh, wow.
Overruled.
You're on it.
All of hospice care?
What is the Medicare hospice benefit? Good job. All right, what would you like to do?
If you please, mixed bag.
Mixed bag for 600? Okay. This is the main patient criteria for Medicaid, Medicare acceptance of home health services. What's the one thing that the patient kind of has to have going for he or she?
Must be homebound.
Good job. Good job.
Homebound.
And remember, the homebound, they can leave their home to go to religious services and to the mall occasionally, but it really has to be an effort. All right, we're going to be homebound in a very few minutes. Hospice for 200, we'll finish it up.
Third party.
Oh, third party.
Third party for what?
All right, third party, we haven't even hit that topic. That was nice talking. Okay, besides being 65, these are 2 diseases that automatically enroll you in Medicare Part A.
What?
What is what?
Adrenal disease.
Yep, and adrenal disease.
And ALS.
And Lou Gehrig's, good job.
Wow.
All right, next one. What would you guys like to do?
Third party for 800.
Third party for 800.
8 bills.
The year when individuals will have to pay a tax penalty for not having health care coverage, which is the mandate.
2014.
What did you say, 2014? Yep. But remember, the penalties won't be higher than their premiums would be, so it might behoove everybody to get insurance.
Third party is 600.
Third party for 600. This represents the percentage of workers that have health care coverage provided by their employer in 2011.
61.
Good job.
69%.
50 to 60. You're up.
Whatever, next highest in the mixed bag.
Next highest in the mixed bag, we got 400. The average wait time for patients in Texas who are waiting to get into a Medicaid waiver program.
Great.
10 years.
Isn't that so sad? Oh my gosh. Yep. Only 300. Oh, only 300 patients a year. That just happened. There you go.
Oh, it's over. We win.
Oh, shame.
Sam, you can start it over. There's no fit. Just kidding. Yeah, just start it.
We accept our win.
Right now,
We're
it's
almost finished.
right now the
guys
chief
are doing
residents
so
are at
great.
3,800. The new ones are at 44, and the others at
Joe, something bad happened.
Y'all lost 1,000 at one point. Calm down.
All right.
Lost 1,000 right off.
Dr. Bosler, you're cutting them short.
You got 1,000.
You're gonna have to add 1,000.
The 2 times burgers and French fries.
no. Wait to deduct 1,000 when you got one wrong.
Not enough just to win, we have to destroy.
I don't think
Winning is easy, destroying is better.
All right. Now I'm forgetting who's up though. Hold on, sorry for the technical difficulty. Oh, there we go. Oh, don't look at that one. Okay. So we had mixed bag. Did I give you the question yet? No, I didn't, did I? Okay, oh, we did.
Yeah, we
Okay, you
got
guys got
it.
it.
We got it.
Okay, you got it. All right, so what are you up next for?
We'll finish that out.
Okay, so 200 for the mixed bag, and then the categories done. The state that has the highest physician to patient ratio.
Eddie,
What is Massachusetts?
My home state. Awesome. All right, there you go. All right, so that category is done. What other thoughts do you have category-wise? Third party, healthcare reform, more Medicare, we have one left on hospice. Healthcare reform for 400. Okay. You guys are doing so well. Another daily double. This is a tough one.
You have 4,600.
All of it. This is a tough one.
I would not do that.
Okay. Do you want us to seed teams? You want to move over somewhere else? Okay, 4,600. You ready? The law that states there are no restrictions on free enterprise if not in Medicare, save for ethical reasons. You guys remember that law she mentioned? The one where when you own your own lab or imaging?
Yes.
I think it's called the Stark Law.
Good job. All right, we got more Medicare, third-party healthcare reform, and hospice. What's your next bet? You want to finish off healthcare reform?
Healthcare reform.
Okay. The percentage that male physicians earn more than female physicians across all subspecialties.
40%.
Sad. Another sad statistic. 40%.
Do we have to complain?
All right, so we have Medicare, third party, and hospice.
Third party.
Third party. You want the high one, right? Okay, 400. This is the type of plan where coverage is provided to participants through a network of selected healthcare providers. Good job. What is a PPO? Okay, you want to finish that one off? You want to finish that one off?
Yes.
Okay, third party for 200. The partiers, the definition of the first party, second party, and third party payers.
Definition.
Who are these payers?
Over others.
The patient, the physician, and the insurance.
Good job. Exactly. The patient is the first, the healthcare provider, clinic, hospital is the second, the healthcare provider, insurance provider is the third. Good job. So we have more Medicare and one on hospice left. You want to do the most, right? These are 2 out of 4 things that are covered by Medicare Part A.
Yep. Other.
Hospice and inpatient care. SNF care as well. Okay. You want to keep going on that one? More Medicare? Okay. We're almost at the daily double, so start thinking about your betting amounts here. Okay, this ensures that a Medicare patient gets coverage for days 1 through 21 in a skilled nursing facility. Part A, and then they also have to have something else. Give me one other. I should have said these 2 things. They have to have a skilled need, okay. What do you guys have to hold patients sometimes in the hospital a little extra long time so that they get, does that not happen to you? The 3-night hospital stay, anybody?
Yeah, that was.
I'm gonna give it to you because you did a good job on that one, but yeah, the 72 hours stay. But that's the big thing, right? The Medicare needs that 72 hours at 3 midnights. All right, you're up. We have more Medicare and we have hospice. Prescription drugs for patients are now paid in part by what funding source?
Medicare Part D.
D, good job. Okay, we're gonna do last one is hospice. And then we'll do our final Jeopardy. You guys are doing everyone paid such good attention. She was the mother of the hospice movement.
Sicily, ordained Sicily.
Saunders, good job. Excellent. In 1960. She was a very, very smart lady. Okay, think about it. Final Jeopardy,
Okay,
Medicare.
Let me tell you who you got. So the chief residents have 4,400. The U1, U2 group has 10,000. And the other group has 2,200.
All right, so everybody think about what they want to bet. This is a good cooperative team. They're really working hard.
Because we have $1.
All right.
No.
Everybody have their bets in?
Okay, chief residents, how much are you gonna bet?
Everything.
All in.
4,400.
Okay.
But they know
What are you guys gonna bet? All of them.
everybody's all in.
All right. Here we go.
$1.
This is the question.
What is her term?
You're not supposed to tell everybody. Everybody's gonna. That's Harry. Well, there you have it. Who was Harry Truman in 1945? You guys were very good sports and excellent players. Excellent players. And great post-test performance, everybody. Poor Harry.
Thanks for coming, and